This is our news, the weekend edition, and on the broadcast tonight, the Medical Association president gives his view on physicians working on a fee-for-service basis, and the Progressive Liberal Party's deputy leader weighs in on those strong tourism numbers.
Our news is brought to you by Alive.
Good evening, I'm Andrew Knowles, and thanks so much for joining us. Topping the news, the president of the Medical Association of the Bahamas weighing in on talks of a fee-for-service mechanism being formulated by the National Health Insurance Authority. While some have questioned the effect it would have on the quality of work by some physicians, the MAB president says he thinks it'll work. Kyle Joaquin reports.
When it comes to physicians working on a fee-for-service basis, the Medical Association of the Bahamas president believes that's not such a bad idea.
The NHI has been talking about fee-for-service and value-based payments where you're paid for performance. And I do believe that that is something that would benefit not only the NHI and the hospital, but also physicians.
Last week, NHI Authority Chairman Dr. Robin Roberts told our news the authority was working on a mechanism that would see physicians in the public healthcare system paid by a fee-for-service method, more like pay for performance. And the authority chairman added that the physicians he consulted with so far agreed with this method. Well, Dr. Cooper, who heads the Medical Association of the Bahamas, says there's a reason why he agrees this would work best.
We put in a lot of hours. Many of us put in a lot of hours, and we don't get compensated for the time that we put in. And so fee for service or pay for performance would actually reflect the work that many physicians do.
And Dr. Cooper went further, explaining why he's taken that stance.
I think that, that whole fee for service and value-based payment would eliminate some of the discussions that we have about overpaying physicians or paying for the underperformers or the non-performers. If you come out and you work, you get paid accordingly, and that's how it should be.
Consultant physicians just this past Thursday went back on the job at public healthcare facilities after a week of industrial action. Those senior physicians were fighting for an increase to their base salary, better working conditions at PMH, and for health insurance. But would this fee-for-service mechanism create a culture where some physicians would feel the need to rush the service to some patients? It's a question we put to Dr. Cooper.
I don't think so. I don't think so. I think physicians, by nature, want to work. We go and get all this training, and the population is full of sick people. We want to get people better. We want to see people's health improve. That's our job. That's our duty. And I think that physicians would be happier, would feel more comfortable, would be confident about going to work if they felt that they were being compensated adequately. And I think that fee for service and pay for performance will do that.
For our news, I'm Kyle Joaquin.
All right, thanks a lot, Kyle. Well, meantime, the Consultant Physician Staff Association weighing in on the National Health Insurance Authority's proposal for a new reimbursement mechanism for physicians. Last week, NHI Authority Chairman Dr. Robin Roberts told our news the authority was working on the mechanism that would see physicians in the public health care system paid by a fee-for-service method. Well, we asked CPSA Treasurer Dr. John Dillett about the CPSA's stance on the matter.
I think one of the concerns the CPSA always has is that there are many comments that are made in public, and sometimes the membership may not totally be up to speed. There can be no advancements in healthcare in this country unless the CPSA, the Bahamas Doctors Union, and the Nurses Union are fully on board. And therefore, there has to be not just communication through the press, but also effective communication in the various appropriate venues that will allow us to come to a decision together on how we can partner and make universal health care reality in the Bahamas.
On Thursday, the CPSA signed a tentative agreement with the government after a week of industrial action. The association has been at odds with the administration at the Public Hospitals Authority. However, moving forward, Dr. Dillard said he'd like for there to be more dialogue between the PHA, the NHI Authority, and all healthcare stakeholders.
So we look forward to meeting with the chairman. We look forward to continuing meeting with PHA and the government of the Bahamas to see how we can all realize our shared dream of universal health care and excellent first world service in the Bahamas. So we are committed to that. But what needs to happen first is you need to speak with us. We need to iron out details. We need to stop making comments to the press until we have the full buy-in of all the partners. All the partners in healthcare need to be a part of the table.
Well, in other news this evening, with tourism officials touting a sharp increase in tourism numbers this year, Deputy Leader of the Progressive Liberal Party, Chester Cooper, says he finds it laughable that the Minnis administration is now raving about a deal they once called fake. Our Jasmine Brown has more in this report.
Cooper noted that in the weeks leading up to last year's general election, the FNM pledged that if the party won the election, it would engage and execute a real sale of the Bahama resort to a qualified and respectable purchaser who believes in Bahamians.
They didn't like the deal at Bahama. They thought, it was a fake deal. And now they're raving about Bahama, how wonderful it is, how good it is for the tourism numbers.
Just over 2 weeks ago, Minister of Tourism Dionisio de Aguilar revealed that an international survey shows an overall double-digit increase in visitor arrivals. According to de Aguilar, the October Forward Key survey, which tracks visitor data, reported that international arrivals have increased by 13% in October year to year. De Aguilar also declared 2018 a banner year for tourism in the Bahamas, noting the tremendous growth the sector has experienced.
I smile as the Minister of Tourism, my friend from Freetown, talk about how the numbers have increased, but he doesn't give credit to the fact that the arrival numbers increased fairly significantly because the people have somewhere to stay. The place is called Bahama, the same place that they thought was under a fake owner, and they promised to find a new owner for it.
In April, when Bahama celebrated the one-year anniversary for its opening, de Aguilar told the press that the resort has been the catalyst for the rejuvenation of the country's tourism industry. He said the government is delighted Bahama continues to come on stream in a more meaningful way than it was a year ago. The tourism minister was once a major critic of Bahama and the steps that landed in under ownership of Chow Tai Fook Enterprises. Cooper says at the end of the day, the government needs to stop playing the blame game and give the PLP credit for the good it has done while in office.
Same old playbook, and it's getting tired, quite frankly. Bahamian people gave the FNM administration a mandate to govern. They said they could do better, and now they only blame the PLP for everything that possibly go wrong.
Reporting for our news, I'm Jasmine Brown.
All right, thanks a lot, Jasmine, and we will take our first break here. But still ahead tonight, a wanted fugitive in the U.S. captured here in the Bahamas. That story and more when our news returns.